Support for Radio Friends comes from Columbia Healthy Smiles, the dental office of husband and wife team Dr. Batson and Dr. Abe, offering comprehensive and customized care to patients of all ages. Learn more by calling 573-721-9039 or online at www.columbiahealthysmiles.com. Good morning and welcome to Radio Friends on Wednesday, November the 10th. You know, we have all talked about the overuse of antibiotics, and we've got a lady here who knows firsthand what can happen if antibiotics are overused. She is an awareness advocate of antibiotics. She is also a sedative survivor.
Yes.
What is sedative? Oh, yeah. First of all, this is Christina Fuhrman. Good to have you here, Christina.
Thank you so much.
Now let's talk about this. What is sedative?
Yeah, C. diff is a
C. diff.
Yeah, it's kind of a tricky word. It's a bacteria that has grown resistant to antibiotics, and it infects your intestines, and it can be deadly pretty quickly. A lot of people die from C. diff a year. It's a non-reportable disease, so we don't know the full impact of it, but it's generally caused by antibiotic overuse, and it's also antibiotic resistant at times.
Now, this is something that you and your daughter almost died from?
Yes, that's correct. So separately, I had an infection in 2011 and she had an infection in 2013. And it was very bad for both of us. Our infections were very tricky to get rid of.
Now, as an advocate to prevent the overuse of antibiotics, what are you doing?
So I want to always use them appropriately. Antibiotics save lives without a doubt. They are so instrumental in our health care, but we use them irresponsibly. You know, we use them for a cold or virus, which are totally unnecessary. They won't do anything for a virus. We use them as a preventative measure, and a lot of times you don't need that either. And I also, you know, for me personally, I try to take care in my house. I don't use a lot of disinfectants. Instead, I use soap and water because disinfectants, yes, they do kill germs, but 99.9, so the 0.1% are infections and bacteria like C. diff, which is what I got sick from. So when you're killing all the bacteria in your home from cleaning, that also kills the good germs and makes the bad germs sometimes stronger.
And that's something we don't think about a lot, is there are good germs and bad germs, and we need those good germs.
Yes.
Now, you were also, we were talking about the fact that we say that we are becoming resistant to antibiotics. It's not us that's becoming resistant. It is the bacteria that is becoming resistant. It is learning how, and it's very intelligent, isn't it?
Very.
And it can mutate. It's learning how to work around the antibiotics when we're using it so often.
Right. And that's exactly true. So if I take a lot of antibiotics, but you don't, you can still catch a resistant bacteria because of inappropriate use from other people, because this is a problem for everyone. And that's why we need to collectively get together and change how we use things. I think of the cancer patients who are so vulnerable, and antibiotic resistance for them is extremely dangerous. And so we need the antibiotics that we have to work every time. But this inappropriate use makes these bacteria stronger and stronger, so that people like you and I, people that have compromised immune systems, are having a really hard time fighting these infections because it's not working anymore.
You said something else that I didn't realize either. You said even if I am not using a lot of antibiotics or not using them inappropriately, I still can be affected by antibiotic resistant bacteria.
That's true. So if you caught an infection, it could be an antibiotic resistant infection. My son just had an ear infection that was antibiotic resistant. So you have to go to stronger drugs, higher power. And so, it wasn't his fault per se that he got an antibiotic resistant infection. They're just out there everywhere.
Don't you believe now that this has been, it's been in the news, more people are aware of it? Don't you think more and more doctors now are saying to their patients, even if the patient asks for it, maybe you don't need that right now?
Yes.
Because I know people will go in and say, oh, I've got a cold, I want an antibiotic, give me something for this. And perhaps in the old days, the doctor, instead of just arguing with the patient, would say, okay, but I think they're changing their attitude on this now.
Yes, the CDC has implemented a lot of antibiotic stewardship programs and just, training doctors to really look for signs on if that patient needs an antibiotic or not. And also us, as patients are becoming more aware that when we're taking these drugs, like it is affecting our gut flora, which is where our immune system is, and it's contributing to this issue. So I think both parties working together, just be mindful. Everybody, the doctors, the patients, the caregivers, all need to be mindful about antibiotic use and whether or not it is necessary.
Sometimes you're feeling sick or you've got a cold or something just isn't right. If you give it a little time, there's a pretty good chance that the body is going to heal itself without intervention.
Absolutely.
Now, that's not saying that you shouldn't go to the doctor. I'm not saying that at all. But most of the time, the body is going to heal itself.
Yes, and that's why you want to have a good relationship with a doctor that you trust, where you're both kind of on the same page as to whether or not an antibiotic is necessary. And you can do watchful waiting. Talk with your doctor. Do I need this antibiotic now, or can I wait a day? And just see how it goes.
Yeah, and it has to be an important trusting partnership.
Yes.
That you have.
Yeah.
And thinking carefully about taking the antibiotic. Now, if the doctor says, yes, you need that antibiotic, then obviously you listen to what your doctor says.
Absolutely.
But if you go in and ask for it and the doctor is reluctant and says, well, maybe not, and you keep insisting, then you are part of that problem.
Right. That's right.
If people want more information, is there a website they can go to?
The CDC has so much information about antibiotic stewardship and awareness and appropriate use. So if you do just a simple Google search about antibiotic resistance, you're going to find a ton of information and from a lot of credible sources out there, like the CDC, the Mayo Clinic, and other sources.
Okay. And obviously, if they would like to email you and start a conversation there, your email address is?
thestonewinters@gmail.com. I'm happy to help anyone through this.
thestonewinters@gmail.com. Boy, that sounds like a cold one coming up. thestonewinters@gmail.com. Okay. Thank you very much.
Thank you.
Christina, pleasure having you here. Pepper P, Missouri.edu. That's mine. Send me an email. Bye-bye.